This is Dr. Caroline Peterson, speaking to you from Natural Women's Health Institute in Sarasota, Florida. Today, I'm going to talk about what is the Sobada. So in manual therapy, there are a lot of different ways to enter into the body. Um, and there are a lot of different needs that the body has. So it's nice to have multiple tools. So when people talk about myofascial release as one form of manual therapy that many people are familiar with, craniosacral therapy, light touch work that many people are familiar with. Less people are familiar with visceral manipulation, the Baral technique, which is also fairly light touch, very specific work, and Maya abdominal therapy. The Arvigo technique is a more indigenous form of manual therapy, which is a deeper touch and often less specific form of therapy. Um, the Sobada is a kind of general term for manual therapy used by indigenous healers in Latin America. And typically it is a very assertive form of manual therapy that is working with adhesions in a way that is deep and transformative. And so when I work with people, I'm listening to their body and I'm listening to their mouths. Both things count. And what I'm listening for is what kind of intervention their body needs and what kind of intervention they want or don't want. And the Sobada can sometimes be after I've worked with the Baral technique, which is very good for the specifics. A lot of times it's helpful to bring in the Sobada because then you're doing like a very deep reorganization of structures and fascia. And so you'll often see a flushing. You'll often see that you're really shifting the vascular system, the movement system of the body, and getting through some old inflammation, dense inflammation, and holding patterns. And so a lot of times I won't start with the Sobada. I'll start with something that's more specific, try to specifically address constraints, and then work deeper, 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 and then end with the Sobada, which is a very deep and transformative technique. But as always, it's important to listen to the patient and what their needs are, what their desires are, and also what their body is able to tolerate or prefer.